Frontiers in Medicine is the program where you can learn about state-of-the-art medicine from doctors who are on the leading edge of medical technology. Our goal on Frontiers in Medicine is to help you understand what current treatments are available for your medical problem. Hello, I'm Nancy Barnes, and today we'll be focusing on the part of your body which takes you around town for work and play. Of course, I'm speaking about your feet. The design of your feet is extremely complex and a marvel of biomechanical engineering. While supporting all of your body's weight, they take you through your day efficiently, effortlessly, and hopefully without pain. But when problems do occur and every step hurts, a specialist in the field of foot and ankle care is the best choice for diagnosing your condition and finding the treatment that's right for you.
The foot is a specialized organ, just like any other part of the body. So when you have a problem, it requires specialized training and knowledge to most effectively diagnose the problem and treat the problem.
Dr. Daniel Bank has been a practicing podiatrist in the Orange County area with offices in Fullerton, Mission Viejo, and Costa Mesa since 1988. He is board certified in foot and ankle surgery by the American Board of Podiatric Surgery and a fellow of the American College of Foot and Ankle Surgeons. He is also director of podiatric surgical residency training at Orange Coast Memorial Medical Center in Fountain Valley.
Well, I deal with the entire gamut of foot pathology, all the way from children with flat feet and ankle fractures, foot fractures, reconstructive surgery for any type of deformity, tumors, even things more commonly seen such as bunions.
But the most common and potentially debilitating foot condition that affects millions of people is medically known as hallux valgus, or more simply as a bunion deformity. Dr. Bank, one of the leading experts in corrective bunion surgery, explains the condition to one of his patients.
Okay, well what you have here is a bunion deformity. What's happening is this bone right here is moving out of position this direction, and this is an inherited problem. It's not caused by shoes.
My foot really has been painful, and after an hour of walking I have to take my shoes off, put it in hot water, or I can't walk. By the end of the night it gets very red and disfigured looking even more than it is now.
I'm Maureen Langley and I'm a personal trainer. When I would hike it would bother me, sometimes when I ran they would both get really swollen. I couldn't wear high heels or pretty sandals. I just knew it was just one of those things that I would never wear a pretty shoe.
My name is Cheryl Houle and I'm an elementary school teacher, and I used to be very involved with dance. I had a bunion for many, many years, and eventually it got progressively worse so that I couldn't even wear a heel to my job anymore and teach. I had to wear a tennis shoe all day long.
My name is Rick Bjork and I taught tennis for about 12 years. Well, after about 6 years of teaching, I started to have quite a bit of pain in the big toe joint of my right foot, and obviously hindered my work quite a bit.
I'm Christina Boberman. I live here in Huntington Beach. In my younger years I worked as a secretary for a large bank, so I had to wear high shoes and dress up every day. And I'd come home and my feet would be killing me.
My name is Sherry Eaton. I had a very bad bunion on my left foot.
My bunion stopped me from doing a lot of things. They stopped me from taking my dogs to the beach, and I loved taking them down to the beach. We would go for long, long walks. When they were really inflamed, I wasn't able to walk on the sand because just the flexion of my toe would really hurt. I had to stop playing soccer. I wasn't able to go hiking as much.
The bigger it got, the worse it got.
I'm using a bottle of Advil every week.
I was actually limping at that time.
Bunions can become so large that they interfere with the normal mechanics of the foot and can cause so much pain that it can become difficult for a person to walk normally, something we usually take for granted.
When a bunion occurs, you have a malalignment of the first metatarsal bone. What this does is creates a bony prominence on the side of the foot, creating a bump, which then you have pressure from the inside from this bony prominence, and then shoe pressure on the outside, which then causes an irritation of the skin and pain.
If left untreated, a bunion can cause an abnormal gait. That is to say, a person's walk is incorrect and unbalanced. Over time, an abnormal gait could lead to problems in the knee, back, hip, and ankle.
The pain on my bunion became gradually worse and worse until it got so bad that I definitely had to call a doctor about it.
I realized that if I was going to be able to continue to play sports and things, I needed to get it checked. and as a result, I went to see Dr. Bank.
Last spring, I was playing soccer, and I was in the middle of a game, and I kicked the ball, and I thought I broke my toe. When I went in to see Dr. Bank, he was so nice. It was really neat. I took off my shoes, and he said, "Okay, that's a bunion," even before I x-ray it. "That's not a broken toe. That's your bunion that's inflamed."
He had gone through in detail what kind of structural problems I had with my foot and what needed to happen in order to repair it.
But once again, knowing that he was board certified and I'd heard many, many good things about him through other sources, that really put my mind to rest and gave me confidence.
And bunions, even though it's not a life-threatening problem, it was a problem that had an answer to make my situation better.
Coming up, you'll see a bunion corrected in surgery and how little time it actually takes to get you up on your feet and walking without pain or discomfort on Frontiers in Medicine. Stay tuned. Heredity can predispose you to the development of hallux valgus, better known as a bunion deformity. Bunions tend to run in families, so if you have a relative with a history of bunions, you're at a higher risk for developing one yourself.
Did your mother have bad feet? I said, yes, Dr. Bank, my mother did have bad feet.
Another risk factor is low arched feet or flat feet. Gender seems to play a part as well. A woman is 4 times more likely to develop a bunion than a man. Fashion, specifically wearing of high-heeled or pointed-toe shoes, can aggravate the joint where a bunion occurs, causing increased pain. Treatments for bunions vary depending on the amount of pain a patient is experiencing and the severity of the deformity. However, in most cases, the most permanent solution for a bunion deformity is corrective surgery.
A bunionectomy realigns the first metatarsal bone, allowing it to move more closely to the second metatarsal, reducing that prominence on the side of the foot, and also realigning the first metatarsal phalangeal joint where the big toe meets the foot. And in that way, you establish normal foot mechanics, reestablish a normal gait, and you reduce that prominence so that you can wear whatever shoe you want to wear comfortably, reduce your pain. Well, I think the best way to approach your problem would be to surgically correct your bunion with a bunionectomy procedure.
Dr. Banks said that the foot was pretty bad and he thought he was going to have to do surgery.
I was very freaked out by surgery. I've never had surgery before.
I nearly fell off the table.
I heard all sorts of horror stories about how you could never wear regular shoes again, that it was incredibly painful, that they never healed right, that they came back.
And I heard some people even say that they that they even were possibly partially crippled, and that really scared me and kept me kind of postponing the possibility of having surgery.
People tell me that a bunionectomy is a very painful procedure, which it is not. Most patients experience very little or no pain. Also, patients seem very fearful that they're going to be off work for long periods of time, they're going to be disabled.
With all the misconceptions about bunions, it's no wonder there are so many people living their lives in pain. So finding the right specialist for you is a critical decision. Dr. Bank understands the complexities of bunion deformities and will find the proper course of treatment for your particular situation while putting you at ease with knowledge, compassion, and professionalism.
Some people say that when you have bunions, you should really wait as long as you can before you have surgery because it's just so painful.
You don't want to wait till it's gotten to that point because it makes it more difficult to correct the bunion deformity, and it can create other problems, secondary deformities. If you have a problem with a bunion, you want to take care of it.
Dr. Bank is a very personable doctor, and he has a wonderful bedside manner.
What's involved with a bunionectomy?
It's an outpatient surgery. It's done local with IV sedation or a twilight type sleep, so there's no general anesthesia.
Yes, I felt that Dr. Bank really listened to me and that he cared, and I heard from other sources too that he was an excellent surgeon, which put my mind at rest.
I've heard it's really painful.
Really, in most patients, they experience very little, if any, pain.
I felt at ease enough to go through with it because I trusted him, and he explained everything so well.
Are there any other questions I can answer for you?
Am I going to be in a cast or crutches?
There'll be no cast. You'll be able to walk right away. You'll be able to go up and down stairs, and we'll take care of your pain.
Never once did I feel apprehensive that I was doing the wrong thing. He explained to me the procedure he was going to be doing, where we were going to be having it done.
I definitely felt comfortable seeing Dr. Bank.
It was real easy to trust him.
And made me feel very comfortable about the decision.
He also mentioned that he did like doing bunions. So I thought, well, here's a great big one.
Coming up, we'll go into the operating room with Dr. Bank as he performs bunion surgery. And we'll hear some remarkable stories about rapid, pain-free recovery right here on Frontiers in Medicine.
A lot of patients at first are very apprehensive, but once I go through the procedure, what it's going to be like after surgery, what's involved in the surgery, they really come around very well.
I can't take that much time off of work, and I've heard some people say it takes 3 to 6 months to be able to wear a shoe and be able to walk again.
If you have a sedentary type job, a desk type job, you can go back to work the week following surgery.
You're kidding me. A week? It sounds too easy. I should have done this a long time ago, but I was just too afraid.
Patients of Dr. Bank spend a minimal amount of time off their feet after surgery and return to work and physical activity soon afterwards. Dr. Bank is able to achieve a short turnaround time between surgery and walking because of his unique surgical techniques, which include the use of absorbable materials.
In most cases, what I try and do is after I realign that bone, I fixate it in its new position with absorbable rods, which then are absorbed by the body naturally over the next several weeks while the bone heals. So what's accomplished is there's no retained hardware, no screws, no pins, and then second surgery isn't required to remove them. It's less recovery time, and it's more economical for the patient.
Being a personal trainer is important for me to get back to work quickly because if I don't work, I don't make any money.
It was really important for me to get back to work quickly so that I could take over the responsibilities of the classroom and not leave the children without a teacher.
After 5 days, I was comfortable enough to go to work with a surgical boot.
7 days I was back to work, and it felt wonderful, and I had no pain after that at all.
When I close a bunion incision, I use what's called a running subcuticular stitch, which is a plastic surgery type closure. What it is a stitch underneath the skin with absorbable material. What this does is it reduces scarring, and it makes it so that there's no stitches that have to come out later on.
When I went to the beach, I would literally hide them under the sand so people wouldn't see me because I thought these are ugly.
I was afraid to get a pedicure. I've always had horrible, ugly, nasty feet.
I get my feet done, but I really can't wear a sandal to show off my feet, so I always try to pick subdued colors so people won't look at it because my bunion's so ugly.
I always sort of kept that foot tucked underneath the other one because I never wanted anyone to say, look at that bump on your foot. So I just feel like right now I just have pretty and perfect feet now.
It feels great not to bury my foot anymore. The bunion's gone, ugly bunion's gone, so now I have a normal foot and I'm not ashamed of my ugly foot that once was.
One of my clients asked to see them, and I took off my shoes and socks, and she went, "Oh, you have pretty feet."
When we return on Frontiers in Medicine,
Next July, we're going to climb Mount Whitney, and my bunions aren't going to stop me.
when most people think about having or not having surgery to correct their bunions, they consider how much time they need to take off from work and the inconvenience of being off their feet. But the one major consideration that sticks out in most people's minds is the possible pain from surgery.
When patients follow their post-op instructions, the bunionectomy procedure can be virtually pain-free. My method of tissue handling, combined with minimal dissection techniques, as well as using long-acting local anesthetic and anti-inflammatory medication before the patient leaves the operating room, really reduces the patient's discomfort. As a matter of fact, some patients are surprised that they have no pain at all after surgery.
I was really surprised at how easy my surgery went after hearing all the horror stories, and I was comfortable, so it didn't hurt at all.
Really what causes a lot of problems are the patient's apprehension of not knowing what's going to happen, how they're going to feel after surgery, and this sort of can create pain. So by explaining to them what they're going to be experiencing, how they're going to be after surgery, being very knowledgeable of what they have to do after surgery to keep themselves comfortable, patients do very, very well. I usually start by seeing the patient after he or she is prepped. Hi Mo, how you doing?
Good, Dr. Bank, how are you?
Good. Just want to see if you have any questions before the surgery.
No, I think we covered everything beforehand.
All right. I just gave you a little bit of sedation, so you may start.
Each patient and each bunion is different, which is why it really does require a lot of expertise and experience to perform bunionectomy procedures. So what we do is we do this local with IV sedation in an outpatient surgery center. We make a small incision on the foot from about here to here. We'll cut this bone, realign it so that it reduces the prominence on the side of the foot. We put 2 absorbable pins to hold the bone in its realigned position so that it heals properly. And we tighten the soft tissues on this side of the foot to bring the toe straight.
It was only about an hour and a half. And then it was done, and then I was in recovery, and then I was leaving.
And I woke up with a smile on my face, and they got me ready to go home, and on our way we went.
I was told these terrible stories about horrible pain for days on end, and I really only had minimal pain the day following surgery, which I was very happy about.
I took pain medication the first day, and after that, I really lived with no pain at all.
I've had other surgeries through the years, but this one had to be the absolute best that I've had because it was the least amount of pain.
The #1 reason to get your bunion fixed is it's going to relieve your pain.
Today, millions of people suffer from bunion deformities and walk with discomfort and pain, affecting their lifestyle and outlook on life. When you consider a bunionectomy with Dr. Bank, remember, most bunions can be corrected by surgery. The procedure itself can be performed without hospitalization, without general anesthesia, and without having to wear a cast. Best of all, most people are walking right away. The bottom line is, why should there be pain with every step you take when you can walk pain-free?
When your pain's relieved, you're going to be able to wear what types of shoes you want to wear. You're going to be able to engage in the activities you want to engage in without having to think about your feet or be restricted by your feet.
Now what I can do that I couldn't do before is I can wear a variety of shoes.
I'm out on the court again and able to exercise again, so it feels great.
And I can now wear high heels and not be uncomfortable or feel clumsy or have my feet aching within a couple hours.
I wasn't able to do this before because it would hurt my toes.
It's very liberating having both my feet done and having the bunions gone. It's nice to know that I can plan things a year from now and know that my bunions or foot pain isn't going to affect me in any way.
I think it frees us up because I don't have to worry about how she's going to feel after she goes out and does something. She's very active, and I'm always worried that she's going to come home and she's going to feel a lot of pain, and now I don't have to worry about that anymore.
And you're also going to prevent a lot of problems from occurring down the line that occur from a neglected bunion deformity, such as arthritis forming in the joint or hammer toes developing. So by fixing the problem, you're able to get back to the active lifestyle you want to enjoy.
Oh, I'm definitely glad I had the bunion surgery.
I have not one day been regretful for having the surgery.
It's just wonderful to feel like I have perfect feet now, and I can just do anything with these feet.
To go to sleep and not think about pain is a great relief and a joy.
The reason I love being a foot surgeon is I'm able to see the positive impact I have on these people's lives that I work on.
He has a lot of wonderful compassion for people that have pain in their feet, and he's a doctor that would like to help people, and I admire that.
I would recommend Dr. Bank to anyone that has any problems with their feet.
I have come across people with bunions and say, well, you know, I know a really good doctor.
Anybody that had similar foot problems that I've had, I would definitely suggest to get in to see Dr. Bank.
I've recommended Dr. Bank to 5 different clients or people I've met so far. I know that 4 of them have gone to him and they're really happy with him.
I'm able to make them happy. I'm able to affect their life in a positive way, and seeing how happy they are after their pain's relieved really is very gratifying.
One thing I'd like to say definitely is thank you It's allowed me to get back on the court again, and that's exactly why I went.
I'd want to say thank you, Dr. Bank. You have changed my life and made it so much better.
Thank you, Dr. Dan.
We hope this episode of Frontiers in Medicine has given you a better understanding of the complexities of bunion deformities and how they can be treated effortlessly, painlessly, and with minimal time off from work or activities. If you or a loved one has a painful bunion, please call 714-434-1776 to schedule an appointment with Dr. Bank. He can assess your needs and answer your questions at any one of his offices in Fullerton, Mission Viejo, or Costa Mesa. Remember, whether you're a professional or recreational athlete, whether you have an active or leisurely lifestyle, regardless of your age, you owe it to yourself to walk without pain. I'm Nancy Barnes. Thank you for joining us on Frontiers in Medicine.